Hello, welcome to our channel. I'm so glad you're here. If you're looking to understand Medicare without the confusing jargon, you're in the right place. I'm Nicole with Holten Insurance, and this is Medicare 101. This video is about giving you a clear, simple breakdown on how Medicare works, whether you're getting ready to enroll, helping a family member, or just trying to get ahead of the game. Holten Insurance has been serving the community for over 25 years, and we're proud to be a trusted local source when it comes to Medicare. We're not here to sell you anything. We're here to educate and help you feel confident about your choices. In this video, we'll go over the basics: what Medicare is, the different parts, how and when to enroll, and some of the common mistakes to avoid. If that sounds helpful, make sure you stick around. And if you have any questions along the way, drop them in the comments and I'll be sure to respond. All right, let's jump in and get started with the basics of Medicare. These are the top 10 Medicare questions we hear from people. First, we'll define what Medicare is and who is eligible for it. Next, we'll talk about Medicare and if you plan to work past 65. Then we'll look at the different Medicare costs and coverage options. After that, we'll touch on how to choose coverage and explain the different enrollment periods. Last, we'll talk about how and where you can find help and more information. Let's start with the basics. What is Medicare? Medicare is a federal health insurance program for people age 65 and older. It also covers some younger individuals with certain disabilities or conditions like end-stage renal disease or ALS. You've likely been paying into Medicare through your taxes while working, but it's important to know it's not completely free. Also, Medicare isn't the same as Medicaid, Social Security, or a family health plan. This is individual health coverage designed just for you. Who can get Medicare? To qualify, you need to be a U.S. citizen or legal resident. If you're a legal resident, you need to have lived in the U.S. for at least 5 consecutive years. And as for age, most people become eligible at 65, but you can also qualify earlier with a qualifying disability and have received disability benefits for 24 months, or any age with a diagnosis of end-stage renal disease or ALS. Let's clear something up because it happens all the time. Many people mix up Medicare and Medicaid. In fact, it's one of the most common sources of confusion we see. People call Medicare Medicaid and vice versa. That's why I always like to take a moment to explain the difference and touch on what Medicaid actually is. So, what is Medicaid? Medicaid is a state-run program that helps pay healthcare costs for individuals, families, and children with limited income and resources. Each state runs its own Medicaid program, so eligibility and benefits can vary, even though they all follow federal guidelines. Now, here is where it gets interesting. Medicare and Medicaid can work together. If someone qualifies for both, they're called dual eligible. And when that happens, the two programs coordinate to help cover most, if not all, of their healthcare costs. There are even special types of Medicare Advantage plans designed specifically for these individuals. They're called Dual Special Needs Plans, or DSNPs, and they offer extra support for beneficiaries who are dual eligible. We've covered who can get Medicare, but before we look at what Medicare covers, let's talk about a situation many of you may be in today: working past 65. If you plan to work past age 65, your Medicare decisions may be different. In fact, you may be eligible to delay Medicare enrollment altogether. This is generally an option for people who work for an employer with 20 or more employees and have employer health coverage that is considered credible by Medicare. Specifically, your plan's prescription drug coverage must be as good as or better than Medicare Part D. People who have health coverage from an employer with fewer than 20 employees must enroll at age 65 or they could face late enrollment penalties. But what about if your health insurance is through your spouse? Well, in this case, you may be able to delay or you may still need to enroll at age 65, even if the spouse's employer has 20 or more employees. This is because employers can have their own rules for covered dependents. Some employers require covered dependents of Medicare age 65, to enroll in Medicare in order to remain covered by the employer plan. You can ask the employer's benefits administrator to learn about your options for this situation. There are some important things to know about getting Medicare when you continue to work. First off, Medicare and your employer insurance can work together. Medicare will typically be secondary to your employer insurance until you leave your employer or lose the employer insurance, whichever happens first. Then Medicare will become primary. Second, if you take any part of Medicare, you will no longer be able to contribute to a health savings account. Think carefully about this if you're eligible to delay Medicare enrollment and are going to keep working. Medicare Part A may seem like a great idea to go ahead and get even if you keep working, because for most people it's premium free. But if you want to keep contributing to your HSA, it may not be the right fit. Finally, Medicare will not cover your spouse or children. If you decide to take Medicare and opt to drop your employer coverage, you'll want to talk with your employer's benefits administrator to understand what options they may offer for spouse and children. For example, some employers may offer COBRA. Make sure you know what dropping your employer coverage for Medicare only means for your family. Now let's talk money. What does Medicare cost? First, we'll start with some definitions. Most people are familiar with premiums, deductibles, and copays, which are defined here. Coinsurance may be a less familiar term. It's an amount you pay when the cost of a covered service is split with you. It's determined by percentage. For example, the cost of a service is covered 80% and you pay the remaining 20%. You may have some or all of these types of costs with Original Medicare, Medicare Supplement, Part D prescription drug plan, and a Medicare Advantage plan. Part A is usually premium free if you or your spouse worked and paid Medicare taxes for at least 10 years. Part B has a monthly premium, and there are deductibles and coinsurance involved. Higher income earners may pay more. That's where IRMA comes in. And don't worry, we'll break all that down in the next slide. Income Related Monthly Adjustment Amount, or IRMA. You'll pay the higher premium if your income is above a certain amount. The extra amount added to your Part B and Part D premium is called an Income Related Monthly Adjustment Amount. Again, IRMA. Let's move on to what Medicare covers. You may have heard about the different parts of Medicare, A, B, C, and D. First, we'll explain Medicare Part A and Part B. Then we'll explain the private Medicare and Medicare-related coverage options, Part D prescription drug coverage, Medicare supplement insurance, or Medigap, and Medicare Advantage, Part C. Medicare has two main parts. Part A, which covers hospital care, and Part B, which covers outpatient and doctor visits. But, and this is important, Medicare does not cover everything. Things like prescription drugs, dental, vision, hearing, and long-term care are not included in Original Medicare. Part A, hospital insurance, covers services provided during inpatient hospital stay. Most covered services are listed here. This includes your room, your meals, and nursing and other services. One important thing you may notice missing from the list is doctor services. That's because doctor services are covered by Part B, even when you're in the hospital. Now let's look at Part B, medical insurance. The main covered services are listed here, including doctor visits, the tests or exams your doctor might order, and other outpatient services. Also, as we just discussed, Part B covers doctor services when you're in the hospital as well. There are a couple things to point out here. First, the annual medical wellness visit is an opportunity to meet with your doctor to discuss your health status and goals, things that a regular visit may not provide time for. It's covered 100% with no copay, as long as it sticks to its purpose. If the discussion veers into current health problems, like a cough, for example, or if you received additional services that are not part of the visit, like lab tests, procedures, or certain other services, then there may be a cost. It's good to know this ahead of time to prevent any surprises. The second thing to point out is about medical equipment, also called durable medical equipment or DME. To be covered, the equipment needs to be medically necessary and prescribed by a doctor. It also needs to come from a supplier approved by Medicare. So, in most cases, you can't just buy a walker somewhere and have Medicare pay for it. Talk to your doctor first. Here are some additional important facts about Part A. Part A has a premium, but few people pay it. Remember the FICA payroll tax? If you or your spouse paid that for 10 or more years, you get Part A premium free. You can't be denied Part A coverage, regardless of your health or financial status, and you're covered at any hospital in the country that accepts Medicare. Finally, you need to know a few terms to understand Part A benefits. Part A coverage and costs are based on benefit periods. A benefit period begins the day you are admitted to the hospital and ends after you've been out for 60 days in a row. Observation status is another important term. Part A covers hospital stays when you are admitted as an inpatient by doctor's orders, not if you're there for observation, even if you stay overnight. Part B would pay some of these costs. Lifetime reserve days are extra covered hospital days you can draw on if you are in the hospital longer than 90 days, the maximum length of stay covered in a benefit period. You get 60 lifetime reserve days. Each can be used only once, but they can be applied to different benefit periods. Here are some additional important facts about Part B. Part B has a monthly premium. If you are receiving Social Security or Railroad Retirement Board benefits, the amount will be deducted from your check each month. Just as with Part A, you cannot be denied Part B coverage, regardless of your health or financial status, and you may see any provider in the country that accepts Medicare. Finally, Part B charges a premium penalty for late enrollment unless you qualify for a special enrollment period. We'll cover enrollment later in the presentation, but some people, including those who work past age 65, may delay Part B enrollment without penalty. We've gone over what Original Medicare Part A and Part B covers. Now let's look at what it doesn't cover. Many people are surprised to learn that they will have out-of-pocket costs, which could be significant depending on individual health care needs. Further, there is no out-of-pocket maximum, no financial protection with Original Medicare. A serious illness or injury could create a real financial stress. Another possible surprise is that Original Medicare does not cover prescription drugs, which can be a big expense as we get older. Other non-covered services include routine dental, vision, and hearing care, long-term care such as in a nursing home, custodial care, which includes bathing, eating, and dressing, and may be called activities of daily living, or ADL, care received outside the U.S., except in limited circumstances. The good news is that there are some options that may help with these non-covered items. Let's explore those now. So, where can you get more coverage? So, if Original Medicare doesn't cover everything, where do you go for extra protection? From these examples, you can see that Original Medicare doesn't cover everything, and that out-of-pocket costs for healthcare items and services could add up and take a bite out of your budget. The good news is that you have options for other coverage that can cover other key things like prescription drugs, and that may help turn that budget bite into a nibble. On that note, we are ready to talk about what Medicare supplement insurance plans, Part D prescription drug plans, and Medicare Part C, or what's known as Medicare Advantage plans, cover and how they may work when you're deciding on what Medicare coverage to choose. You have two options for more coverage. Option one is to add a Medicare supplement, or what is known as a Medigap insurance, and or a Part D prescription drug plan to Original Medicare. Medicare supplement insurance will help pay some of the out-of-pocket costs not paid by Medicare, Part A and B, and Part D will cover prescription drugs. Option 2 is to choose a Medicare Advantage plan, also known as Part C. Most Medicare Advantage plans include drug coverage and may offer additional benefits, such as routine dental and vision coverage. Before we delve into these options, I want to point out that all three of these components shown, Medicare Supplement Insurance, Medicare Advantage plans, and Part D plans, are offered by private insurance companies. What this means, in part, is that there may be several plans to choose from, and they may vary in coverage and cost. By contrast, Original Medicare is administered by the federal government, and benefits and costs are the same for everyone. Medicare Advantage and Part D plans are approved by Medicare and held to standards set by Medicare. These private plan options are provided to give you more choices and the ability to fill in for what isn't covered by Original Medicare. Now we come to Medicare Supplement Insurance, or what's often called Medigap. Medicare supplement insurance plans are also offered by private insurance companies. As the name says, they supplement Medicare, and they are not Medicare plans in and of themselves. Medicare supplement insurance plans help to pay some of the out-of-pocket costs that come with Medicare, like deductibles and coinsurance. They can only be used with Original Medicare, not with Medicare Advantage. Plans are standardized by the federal government. There are 10 plans labeled with letters, Plan A, F, G, and N, for example. Every plan of the same letter provides the same benefits, no matter what insurance company offers it. Massachusetts, Minnesota, and Wisconsin are exceptions to this rule, as these states standardize their plans differently. It is also important to note that Plan C and Plan F are only available to individuals who are eligible for Part A or turn 65 before January 1st, 2020. Here are some of the costs that Medicare supplement plans may help with and some that they may not. You'll see that they help pay for coverage already provided by Original Medicare and may extend it in some cases, as with extra hospital days. Medigap plans can help with Part A deductibles, Original Medicare copays, coinsurance, and provider excess charges, cost of blood transfusions, and cost of foreign travel emergencies. Additionally, some programs may cover Part B deductible costs, but only for those individuals who are eligible for Part A or turn 65 before January 1st, 2020. But except for foreign travel emergency coverage, Medigap plans don't fill in for what Original Medicare doesn't cover, such as prescription drugs or dental and vision care. Some plan providers may offer value-added services for free or on a discounted basis, but they're not part of the Medigap plan directly. This table may help you visualize, if not read, which cost different standardized plans help with and the level of coverage. 100% means 100% covered. The main point here is that Medigap plans vary. Now for some fast facts. You must be enrolled in both Part A and Part B to be eligible for Medicare Supplement Insurance Plan, and you must choose from the plans offered in your state. Also, there is a set enrollment period when you can't be denied coverage or charge more based on your health history. Medicare supplement insurance coverage is nationwide and goes with you wherever Original Medicare does. And while plan benefits are standardized, each plan sets its own premium. The amount can vary, even for the same coverage. For example, you and a friend who lives in a different state may both have Plan G, but your premiums may be very different. Finally, you must continue to pay the Part B premium to Medicare. Now let's move on to Part D, prescription drug coverage. An easy way to think about this is D for drugs. Remember, drugs are not covered by Original Medicare except in select circumstances. You can get drug coverage in two ways, through a separate standalone Part D plan or through a Medicare Advantage plan. Standalone Part D plans can work with Original Medicare, Medicare supplement insurance plans, and select Medicare Advantage plans, including private fee-for-service plans, or PFFS, and medical saving account plans, or MSA, without drug coverage. Part D plans are offered by private insurance companies. Each Part D plan or Medicare Advantage plan that includes drug coverage creates a list of specific drugs that it will cover. The list is called a formulary. Each plan has its own list of covered drugs, but every plan must cover a range of both generic and brand name drugs that are generally needed by people on Medicare. Plans also cover all commercially available vaccines, like the shingles shot, that aren't covered by Part B. Part B covers things like flu and pneumonia shots. Many Part D plans group the drugs they cover into levels or tiers. Drugs in different tiers have different costs. For example, You may pay more, a higher copay or coinsurance, for a Tier 5 drug than for a Tier 2 drug. Also, plans may have a deductible for some tiers and not for others. When choosing a plan, it is important to make sure that the drugs you take are on the plan's list of covered drugs and to understand the costs, which can vary from plan to plan. Let's take a minute here to talk about the three different Part D cost stages. The stage you're in determines the amount you pay when you fill a prescription. You begin in the deductible stage, if your plan has one, where you would pay the full cost of your drugs until you reach the deductible amount set by your plan. Once you meet the deductible amount, you move into the initial coverage stage. In the initial coverage stage, you will pay your plan copays or coinsurance. Once you and others on your behalf have paid a combined total of $2,000, including any amount paid toward a deductible, you move to the catastrophic coverage stage. Once you enter the catastrophic coverage stage, you won't pay anything for Medicare covered Part D drugs for the rest of the plan year. A few final points about Part D. You are eligible to join a Part D plan once you are enrolled in Part A, Part B, or both. Plans often have a pharmacy network that you need to use to get the plan's pricing. Plans may vary quite a bit in terms of what specific drugs they cover and what your costs may be. A final key point is that you could be charged a premium penalty if you are late enrolling in Part D, unless you qualify for a special enrollment period. Part C is Medicare Advantage. It's an alternative to original Medicare and offers another way to get your Medicare Part A and Part B benefits plus more. You still have Medicare and Medicare contracts with the plan to administer your Part A and Part B benefits. You'll also continue to pay your Part B premium directly to Medicare. Plans are offered regionally, often in a county or state, by private insurance companies. Most plans also include other benefits like prescription drugs, dental, and vision. By law, Medicare Advantage plans must provide all the benefits that original Medicare does. So plans combine Part A and Part B coverage in one package. One exception is hospice care, which is covered by Part A, even when you have a Medicare Advantage plan. Most Medicare Advantage plans also include built-in prescription drug coverage, or Part D. Finally, Medicare Advantage plans may also offer additional benefits, including coverage for dental, vision, or hearing care, as well as fitness programs. The result is an all-in-one plan similar to what you may have been used to having through an employer. There are different types of Medicare Advantage plans. Most are coordinated care plans where care is delivered through a provider network. You may get care outside the network, but you may pay more or even the full cost. Most coordinated care plans are HMO or PPO plans. HMO plans have a network of doctors, hospitals, and other care providers you use to receive covered services. POS plans are a type of an HMO plan that also lets you see providers outside the plan network for certain covered services. PPO plans have a provider network you can use, but also offer more freedom to see providers outside the plan network for all covered services. Special needs plans are designed specifically for people with certain healthcare needs. The dual special needs plan we talked about earlier is a kind of special needs plan specifically for those with both Medicare and Medicaid. There are also chronic special needs plans, which are for people who have certain chronic conditions such as diabetes, institutional special needs plans for people living in a skilled nursing facility, and institutional equivalent special needs plans for people living in the community and need the same kind of care as those who live in a skilled nursing facility. Private fee-for-service plans typically offer more flexibility in choosing providers than other types of plans do. In general, you can get care from any Medicare-approved provider who accepts the plan's terms and conditions. Medicare savings account plans combine a high deductible health plan with a medical savings account. They generally offer more choice with more financial risk. Here are some additional things to know about Part C. You must be enrolled in both Part A and Part B to be eligible for a Medicare Advantage plan. You must also live in the plan's service area, and you can't be denied coverage. You may pay a premium to your Medicare Advantage plan and continue to pay your monthly Part B premium to Medicare. It's easy to get confused by this. The plan provides Part A and B coverage, but you still need to enroll in Parts A and B. As we mentioned, you're still in the Medicare program. Medicare contracts with the plan to administer your benefits. Importantly, unlike original Medicare, every Medicare Advantage plan has an annual out-of-pocket maximum for Part A and Part B services covered by the plan. Once you've paid this amount, the plan covers the entire cost for these services for the rest of the year. Keep in mind, the out-of-pocket maximum doesn't apply to your monthly premium, prescription drug costs, or any costs for additional benefits not covered by original Medicare, like routine eyewear or hearing aids. Medicare sets the standard maximum, but many plans cap your costs below this amount. The out-of-pocket maximum limit in 2025 is $9,350. So how do I choose? We have covered a lot. Hopefully, you now have a basic understanding of the different parts of Medicare, Medicare supplement insurance, and the costs you could pay. Now what? Let's think about this choice in terms of coverage, cost, and convenience. Coverage. Provider choice is one of the main considerations between these coverage options. Medicare supplement insurance helps pay for care from providers nationwide. Medicare Advantage plans generally have provider networks, and each serves a set geographic area. Another key consideration is what you need coverage for. Do you want coverage for prescription drugs, dental, and vision? Questions to ask. Am I able to get most of my healthcare needs met near home? Am I willing to change doctors if mine isn't in a plan network? Do I want coverage for additional healthcare services like dental, vision, hearing, or fitness? Now let's look at cost. Both options help manage costs, but in very different ways. With a Medicare supplement or Medigap plan, you may pay higher premiums than with a Medicare Advantage plan, but other costs may be lower. With a Medicare Advantage plan, you pay copays, but the premium may be low and you are protected by an out-of-pocket maximum. Questions to ask here are, how often do I use healthcare services? Would I rather pay higher premiums even when I don't use services, or would I rather pay copays when I do use services? What level of Medicare supplement insurance can I afford? Lastly, convenience. Many people who opt for a Medicare supplement plan also buy a Part D plan. With original Medicare, that's 3 different plans. With Medicare Advantage plans, it's usually just one. Questions to ask. Which coverage option is the best fit for my lifestyle? How do I feel about working with multiple insurance carriers? What Part D plans are offered where I live? What Medicare Advantage plans are offered? Whether you choose Medicare supplement insurance or Medicare Advantage, be sure to consider your needs and budget and to compare plans before making a decision. Once you decide on your coverage, you're ready to enroll, so let's explore the different enrollment periods. Most people first enroll in Medicare during their initial enrollment period, or IEP. Your IEP is 7 months long. It includes your 65th birthday month plus the 3 months before and the 3 months after. If your birthday is on the 1st, then your enrollment period begins and ends 1 month earlier. If you qualify for Medicare due to disability, then your IEP includes your 25th month of receiving benefits, the 3 months before and the 3 months after. You are enrolled in Medicare Parts A and B automatically if you are receiving Social Security or Railroad Retirement benefits at age 65. You'll get your Medicare card in the mail. Otherwise, you need to sign up yourself online, on the phone, or at your local Social Security office. During your initial enrollment period, you can also enroll in additional coverage, Medicare Advantage or Part C, a Medicare prescription drug plan or Part D, or Medicare supplement insurance, also known as Medigap. To get any of these 3 plans, you'll need to enroll with the private insurance company offering the plan. A final note, you may refuse or delay Part B enrollment and take just premium-free Part A. This may be a good idea for people who have employer or other credible coverage. Some employers require you to take full benefits Part A and Part B at age 65. You also may join a Medicare Advantage or Part D plan during your IEP if you're eligible. Ensure you decide to delay that doing so won't mean paying a late enrollment penalty later on. It's important to pay attention to the timing of your enrollment to avoid late penalties. We'll talk more about penalties in a minute. If you miss your IEP, don't panic. You have another chance to enroll called the General Enrollment Period, or GEP. The GEP is January 1st to March 31st every year. You can enroll in Part A, Part B, or both. If you're eligible, you can join a Medicare Advantage or Part D plan until June 30th of the same year. Late enrollment penalties may apply depending on your timing. Again, we'll get to that in a minute. You must be enrolled in both Part A and Part B to be eligible for a Medicare supplement insurance plan. You are not subject to medical underwriting for 6 months after you enroll in Part B at age 65 or older. You can still apply for Medicare supplement insurance plan after this time period, but you may be denied coverage or charged more based on your health history. Some states may allow for additional open enrollment periods, such as under the Illinois Senate Bill 147, also known as the birthday rule. Since you may be subject to underwriting, you are able to enroll in or change your Medicare supplement policy anytime during the year. We talked about working past 65 a bit earlier and how you may be able to delay. If you qualify, Medicare provides a special enrollment period for people who work and have employer coverage past age 65. You have 8 months to enroll in Part B and Part A if you haven't already. You may enroll in a Medicare Advantage or Part D prescription drug plan within the first 2 months. It's important to pay attention to this timing. As we mentioned, both Part B and Part D charge late enrollment penalties. The Part D enrollment deadline is especially important since it happens quickly and can sneak up on you. One more thing. Make sure your employer provides you with proof of credible drug coverage. This means it's at least as good as Part D provides. If your drug coverage doesn't meet the standard, you could be penalized. Remember that your 6-month Medicare supplement open enrollment will be triggered once you are enrolled in Part B. Also, you must be enrolled in both Parts A and B before you can enroll in a Medicare Advantage plan. Let's take a closer look at penalties. Part A, Part B, and Part D may charge a late enrollment penalty. The Part A penalty doesn't apply to many people since most of us get Part A premium free. But for those who have to pay, the penalty is an additional 10% of the premium amount. You pay the penalty for twice the number of years you could have had Part A but didn't sign up. The penalties for Part B and Part D could apply to more people. It's important to understand the enrollment periods we just discussed and to enroll on time in order to avoid them. The Part B penalty is an additional 10% of the premium for each full 12-month period. You could have had Part B but didn't, unless you qualify for a special enrollment period. You pay the penalty for as long as you have Part B. The Part D penalty is an additional 1% of the current average plan premium for each month you're late. You pay the penalty for as long as you have Part D. Remember, you need to have credible drug coverage as good as Part D to avoid this penalty if you enroll after your initial enrollment period. When can I change my coverage? Medicare is not a one and done decision. Things may change in your life, your health, your finances, or even in Medicare or your plan. So it's important to review your coverage every year to see if it will work for you going forward. You can change your coverage choices if you decide to during Medicare annual enrollment, which is October 15th through December 7th every year. The new coverage goes into effect on January 1. The kinds of changes you can make are listed here. We won't go into this too deeply. The main message is that Medicare provides this annual enrollment opportunity so you can keep your coverage up to date and with your life and needs. The Medicare Advantage open enrollment period is specifically for Medicare Advantage plan members and runs from January 1st to March 31st. You must be a member of a Medicare Advantage plan on January 1st to be eligible for this enrollment period. During this time, you may switch to a different Medicare Advantage plan or drop a plan and go back to original Medicare, Parts A and B. If you return to original Medicare, you may also enroll in a Part D plan until March 31st. You may enroll in a Medicare supplement plan as well. You may only make one coverage change during this enrollment period. The next opportunity is the fall annual enrollment period, unless you qualify for a special enrollment period. Medicare offers a special enrollment period, SEP, for qualifying life events. This is for those times when life doesn't happen on Medicare's schedule. Certain situations, such as moving to a new home or certain changes in your healthcare coverage, can qualify for a special enrollment period. In most cases, you have 2 months from the date of a qualifying event to make coverage changes. During a special enrollment period, you may join, switch, or drop a Medicare Advantage or prescription drug plan. However, there may be some restrictions depending on how you qualify for the SEP. Again, we won't go into this much more. The main point is that Medicare provides for times when you might have to change your coverage outside the usual annual enrollment period. Where can I go for help? If you need it and you qualify, you may be able to get help paying for some healthcare costs. There are several programs as shown here. It's worth asking about them, even if you think you won't qualify. A good place to start is with your State Health Insurance Assistance Program, or SHIP office. You can find the number at shiphelp.org or by calling Medicare at the number shown. You can also find helpful information at Medicare.gov, the official government website for Medicare, or you can call Medicare at the number listed here. You may want to talk to your state health insurance assistant program to see if you qualify for any financial assistance, or contact Social Security or your state Medicaid office to learn about other assistance programs. You also have access to our unbiased, completely educational Medicare 101 and Medicare Scholar videos. Our Medicare Scholar videos drill down deeper into specific Medicare topics. You can find these videos online on our website at www.holten, that's HOLTEN, insurance.com, and our YouTube channel. You can also check our website for in-person educational events. Thank you so much for viewing our Medicare 101 video. If you have any questions, please feel free to contact us at 630-424-0200. Thanks again.